Good morning. I'm Dr. Tennant, and this is my partner, Dr. Motlock. We, in our office, take a neuromuscular approach to our bite registrations, both for our TMD patients and our Vivos patients. Today, I am the patient. I have been on a myomonitor for about 30 minutes, and Dr. Motlock is going to take over now and demonstrate our bite.
So I'm going to demonstrate a myobite registration or physiologic bite. We know that the main cause of TMJ noise, breakdown, and muscle spasm is a mandible that's been thrown off of its closing on physiologic trajectory. We all got familiar with physiologic rest position at dental school, and we know how important it is to have muscle balance and joint balance. So one of the main reasons for the mandible being thrown off of the trajectory is a small midface, as we know, and malocclusion that comes with it. So when the patient's chief concern is TMJ pain and discomfort, we like to address their chief concern, calm that joint down, give them some assurance that they can be pain-free, and we achieve that by using FDA-approved ultra-low frequency electrical neural stimulation to stimulate the trigeminal, and that relaxes all the muscles of non-mastication and allows that mandible to go through pitch yaw roll movements and land to its ideal physiologic rest position. Then from there we accommodate for an envelope and function and what is that? Freeway space. So we put our bite about a couple millimeters, 1 or 2 millimeters above the physiologic rest position, and we stabilize the bite by having the patient wear a segmented orthotic by myoliner for about 3 months so they can chew and function there and stabilize the joint and the mandible. Once the patient's chief concern is addressed, then I transfer the patients to Dr. Tennant to do the airway evaluation, sleep studies, and start getting into midface expansion and address the root cause of the problem. So for you, we went through this about a year ago, and I made you 2-segment myoliner for your lower posteriors to for the mandible to bring your jaw forward a little bit, right? To a physiologic position. Did you have any canting?
I did not.
Okay, so it's just mainly AP shift. Okay, so on that address your concerns.
It did. I was very comfortable during the day while I was wearing, when I was not wearing my Vivos appliance.
Yes, so this was a daytime solution for you.
Yes.
Yeah, and then now you've opened up quite a bit, Look at those spaces that she has gained with her Vivos, because you went through ortho about 40 years ago, 40 years ago.
I did.
You had
I had
bicuspid
four bicuspid extractions.
Yes, which brought you the lovely sleep apnea issues,
Yes.
and you were severe sleep apnea.
Severe sleep apnea.
After
Yes.
that, yeah. So, but with this expansion, you're down to moderate.
I'm down to mild.
Mild. Wow.
Sleep apnea.
Okay.
And have opened up more than half of my premolar space.
That's great.
Which we will begin to decide how the restorative process will go with that.
Okay.
As I finish.
Perfect. So now today, that when we find her myobite, our plan is to go ahead and give her a segmented orthotic on the right and left side on the posteriors. You can kind of like see that bicuspid drop off. So we're going to correct the plane of occlusion for her there, and have her wear. And the nice thing about the segmented is that it doesn't cause any mandibular flexion or doesn't put any stress on the cranial bones and movement. That's the whole idea behind segmented orthotics, is to reduce the force on the cranial bones. So after that, then we can go ahead and we can continue to expand because it's segmented, right? So at night.
That was the beauty of it. I could continue, because it's segmented, and the segments, as all of you Vivos docs know, the segments actually move together. I was able to continue to wear the posterior segments to keep me comfortable during the day as I expanded, throughout the night and those several hours during the day.
And that design we have found works beautifully for patients that have crossbite, So, you know, at night when Vivos is expanding their upper jaw, during the day they don't reverse that by biting on their pathologic occlusion. We put them in daytime myoliners so we can have really flat occlusal surfaces, and they will continue to expand and jump that crossbite. So we had great success with that. So I'm going to go ahead and now show you where her bite is and how far it is from her physiologic rest position. And if you want to get really advanced, you know, we have techniques that we can look at muscle activity, like on the monitor, you can see temporalis, masseter, you know, and we can measure muscle activity with EMGs. We use K7 evaluation system by Myotronics, and we also can do jaw tracking. So I'm going to actually retract your cheek and show your bite currently. Go ahead and bite down. Okay. And now go ahead and just rest your jaw and let the tensing take over. Bring your jaw forward, wiggle a little bit side to side, open wide, and let it float. Go up higher a little bit. Yes, perfect. Let me lower this intensity. Close a little bit. You can see that gap right there. And you can see how her mandible came forward a little bit, and you can see how much drop off she has on that corner. So our goal is to give her that lift with a 2-segment myoliner until she finishes her Vivos treatment. So usually I sit right in front of the patient. I make sure their shoulders are upright a little bit. Usually I'll just have the patient see a chiropractor because it's all about craniosacral alignment. You want to make sure there's no canting, patient is relaxed. If they have jaw popping and clicking, I will have them move the jaw forward a little bit, wiggle side to side, open as far as you're comfortable, and then let it float. Let the jaw float, and you can see that mandible will just repeatedly go into that physiologic rest position. And then you can just close the video a little bit because that's the most forgiving aspect of the occlusion. It's usually canting of the mandible and the AP shift that really causes a lot of pain and discomfort. The VDO is most forgiving. So I'll just have her, as I'm just looking at her face, make sure everything is aligned. Don't open. Yeah, I'm just going to retract your lips, close just a little bit, open just a hair, close a little bit. I'm looking at that gap and just putting a little tag right here. Now the patients have the tendency to open. I'll just lower this, have them just gently, just close just a little bit. Good. Keep going a little bit more. Good. Okay, now I just take a tag, but as I said, you can have the patient connected to a K7 and actually see that movement of the mandible, but that's more work. A lot of times a TENS bite for a removable appliance is perfect. Now that has stabilized, you can kind of like see right there, you can see how much gap she has on her posteriors as opposed to her anteriors. So once you get your tag bite, you can double check it. Open, please. Okay, bring your jaw forward, side to side. Okay, open wide. Let me increase the TENS, and we want to make sure that it goes to the same spot. And if it doesn't, we'll repeat it. Is it comfortably going to the same spot? Mm-hmm. It's not shifting your jaw? Mm-hmm. Okay. Okay, now you'll go and open, please. And then because you already have that tag bite, you can transfer that to the rest of the teeth. Okay, go ahead and just close on that, on your guide. Find your guide and close. Perfect, stay closed. Relax your face. Okay, so when we receive your upper and lower models and your bite registration at MyoAligner. We'll go ahead and scan the upper and lower jaw. We'll scan your bite registration, and that way we can get a digital articulation and we can see the interocclusal gap between your teeth. We can close on the articulator. We can just close the video just by a hair, by 1 millimeter, not more than that if needed, and then fabricate the two posterior segments for you. You know, we can show them later on how the segments will go in. If doctors are interested, they can go to MyoAligner website or to our website at Aesthetic Smiles and see how the segments look. Go ahead and take it out. Okay. So that's our bite registration. You know, as I said, we can just take it more sophisticated with the K7, but I just wanted to show a more simple MyoBite technique that any doctor can use. And I mean, MyoMonitor is FDA cleared for, and we've been using it for 20 years, but there's other 10 systems that they can also use to relax the muscles. But this can get you the physiologic position in half an hour, as opposed to putting patients in a flat plane appliances, you know, taking a lot of adjustment to kind of like bring that mandible to physiologic rest. This can just get it for you in half an hour.
And I have found that when I have a Vivos patient that is their chief complaint is not TMD, what I know and what we all know as Vivos doctors is always that mandible will position forward in any type of bite that you take in practice. And so I've found that putting them on the MyoMonitor helps me get that more dialed in right at the beginning, so that I can begin their Vivos appliance process with what I consider a very really physiologic, comfortable bite.
Yeah. And what I have found is that if the patient has asymmetry in the growth of the midface, or their mandible is canted to one side, you will see that the mandible will just decompress more on that side. So our MyoAligner will be a little bit taller on, for example, the left side than the right side, and that will allow, I think that will even help with the growth of the maxilla when you're doing it, because the mandible is not banging into it, or
Exactly.
you know, when the mandible is in the right position and supports that mid-face growth, things the case just goes much faster.
Yeah, it when we have a canted bite, the tensing relaxes that, and so when you get your Vivos appliance back, you'll see that often it's a little thicker on one side than the other.
Mm-hmm.
We've got that jaw positioned such that those joint spaces will remodel, and most often it corrects the cant that I've started with. So it's a pretty wonderful way to take a bite.
I always say, if I have to leave with only one item from my practice, it's the TENS machine. You know, it just really, it brings a lot of value to the practice, helps you take a nice physiologic bite and help your patients and alleviate their pain like that. Usually within a week after delivery of MyoAligner, the discomfort is gone. And usually within half an hour, the pain, the noise of the TMJ is gone, because now the lateral pterygoids, medial pterygoids are relaxing, and it really allows for that disc to jump right on top of the condyle if you have the correct closure. So I think it's going to bring a lot of value to your practice. Thank you.